Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine.
If you or a loved one are struggling with pain, it's time to take action. Today, our Good Morning Washington Health Spotlight is focusing on how the experts at Regenerative Orthopedics and Sports Medicine are helping countless patients across the DMV get out of pain without surgery. And today, I'm joined by Dr. Haider. Welcome. Thanks so much for joining me this morning.
Thank you.
So, Dr. Haider, you're relatively new to ROSM. Tell me what drew you to the practice and what excites you most about being part of ROSM?
Well, ROSM is a practice in the DMV that focuses on treating patients with regenerative treatment techniques and with sports injuries and various different musculoskeletal type injuries. So I was excited to join ROSM to bring in specifically spinal treatments for the discs and various different spinal components to the patients that ROSM serves in the DMV.
So orthobiologics, you know, we kind of hear it in the news, we hear it around, it's a growing field. So how is it transforming the way that patient care is now?
Well, orthobiologics essentially uses a patient's own natural cells that are in their body, and we use those cells to help heal damaged and injured tissues. Those tissues may be various tissues of the muscles, ligaments, tendons, joints, or bones, but using a patient's own cells, we can help them heal naturally without the use of medications or chemicals.
Incredible advancements that they're making now. Can you talk me through some of the key procedures and treatments that you do at ROSM?
Yes, so specifically I treat the spine, so I treat patients who may have conditions such as scoliosis, sciatica, disc herniations, arthritis. All of those conditions could be treated with regenerative medicine. And some of the procedures that I do would include the use of a patient's own bone marrow or a patient's own platelet-rich plasma types of cells to help heal them. Specifically, we do injections around the nerves, which are called epidural injections with these natural components. We also do a procedure for the disc, the spinal disc, which I invented and which is actually trademarked, called the biodisc procedure. The biodisc procedure essentially is a two-step procedure in that it heals all the areas of the spinal disc. The disc consists of a nucleus, which is the jelly in the middle of the disc, and an annulus, which is essentially the cartilage on the outside. So the biodisc procedure takes a patient's own natural cells and injects them in the jelly part, the nucleus, and we take something called fibrin glue, which is also in the patient's natural tissues, and we inject that into the annulus, or the lining of the disc. So not only are we providing natural healing to the center or the nucleus of the disc, but we're also providing a sealing mechanism to the outside of the disc to help the disc heal naturally over time.
That's incredible. And all of this, I mean, you can completely avoid surgery, and you might even heal faster, right, than surgery?
Correct. So our goal is to avoid surgery at all costs if we can naturally help you heal. So many of the patients that we see do just that.
So for people watching at home right now, they're sitting in pain. What is your message to them, and how can they take that first step to getting out of pain?
Well, the first step would be to come in and see one of the excellent ROSM providers. We would look not only at all of the other places they've been and all of the other notes that they may have from other physicians to take those things into account, sometimes even being surgeons. And then we would look at specific diagnostics, including MRIs and X-rays, sometimes nerve conduction studies, and we would take all of those things and look at the person individually, perform a thorough physical examination, and utilizing all that information, we make an individualized treatment plan for that person. And the treatment plan obviously would avoid any type of surgery to try to help them heal naturally.
You're making sure that everyone can get out of pain. Dr. Haider, thank you so much for joining me this morning.
You're very welcome.